we do have in program in 10 days the SOHO Italy virtual and in-presence meeting. The SOHO Italy is touching upon several subjects and several important issues, one of which is the treatment, the update of the treatment of MDS in Europe. There are evident differences between the treatment that you can offer in the United States and what you can offer in Europe. The first one I think of is the possibility to treat lower risk patients with hypomethylating agents. In Europe, it's not possible. We have been treating them in expanded access in the past, compassionate use, but is clearly off-label. And although I think we have to select very carefully the patients who could take advantage of hypomethylating agents, it's a kind of therapy that could help us in some cases, and would be interesting, especially now that we have the oral drugs, to have access to this treatment. Another unfortunately important difference is that companies are giving access to experimental drugs much more easier to the colleagues and physicians in the States than in Europe. So we struggle quite a lot to get early access to experimental drugs and to have our spontaneous studies approved. So this means that we are a little bit slower in achieving results with new drugs. Nevertheless, I think that overall Europe has a quite homogeneous algorithm of treatment. We can treat patients pretty well, both for low risk and higher risk MDS. We do not have at present many options of treatment for the, let's say, the poorest prognostic ones. So the ones who lose response after hypomethylating agents and have a high-risk disease. We do not have at present many options. One of the interesting options is the APR-246 drug, that is an anti-TP53 mutated drug that's reactivating TP53 in these patients, but is available only as an experimental trial in France. In Germany and in Italy, as far as I know, as well as in Spain, is not available. We are actually very proud to share a platform for scientific studies and clinical studies in MDS, that is the EMSCO. The EMSCO is an European platform proposing clinical trials, and it is accessible for all European countries. And we have promoted several studies that have given very good results. Because, of course, being all together, the number of patients that can be enrolled and the rapidity of the production of the results is much higher. So I think we have to go this way and just implement more studies into the platform, propose more European studies, because I think this is the winning strategy for our patients.